kind of reflecting now, I think I had 3 goals going into PD time. So the first was really to be able to develop my analytic and statistical skill set. And I had like very specific reason for this. I'd worked on a lot of research projects, but I hadn't been able to sort of do the statistics part myself. I'd always collaborated with great statisticians, and I thought this would be a really nice time to delve into how do I do the own stats for my research. So that was one of my major goals. And the way I facilitated that actually is there was a great program that's run out of Harvard. It's been there for over 20 years. It's called the Program in Clinical Effectiveness, and it's geared for clinicians who want to basically boost their statistical skill set. So it was sort of like a 6-week boot camp that I went there for. My family lives in Boston, so that was a nice kind of complementary thing. And it really kind of launched me into, okay, here's how you code in SAS, here's how you look at your research questions. So that was a really great way to start, and that's how I started my PD time. So that was a nice launch. And then I think my second goal was, okay, now that I'm trying to develop these specific statistical skills, how can I apply these to research projects in vascular surgery? So my prior research has always been in complex aortic aneurysm disease and using custom-made devices to treat patients and what the long-term outcomes of those treatment modalities are. And so I wanted to use my PD time to sort of expand on that research. So together with Dr. Lee and then Dr. Tara Chang, who's the chief of nephrology, we actually wanted to look at some specific renal risk factors in our patients. So we did some cool projects looking at CKD, chronic kidney disease at baseline, as well as baseline levels of proteinuria to try to see, can we more accurately stage patients preoperatively and see how that might impact their long-term outcomes. And so I guess along with that, it was really also a goal of mine to be able to collaborate with people outside of vascular surgery during my PD time. So nephrology was a great example. Another was in cardiothoracic surgery with Dr. Claire Watkins. We did some interesting projects on type A aortic dissection outcomes, as well as looking at could we use calcium in the thoracic aorta to risk stratify patients kind of for their cardiovascular outcomes. So those are just some examples of projects that I'm proud of because we were able to kind of reach across the aisle and work with other disciplines to sort of still delve deeper into outcomes for vascular surgery patients. And then I think the third goal was to really be able to go outside of my comfort zone and kind of expand my research toolkit, I guess, for lack of a better word. And so the way I looked at that was I guess I'll get to this in the next part, but sort of my funding came through health policy. And so my appointment was officially with them. And through that, I was able to take some really great courses in cost effectiveness analysis, outcomes analysis. So really learn how to apply new analytic methods to maybe even some of the same, or sort of how to ask your research questions slightly differently and maybe apply it to new data sets. And then it kind of opens up a lot more possibilities. So those were kind of my 3 main goals. My funding came through a T32 in the Department of Health Policy, and that is a funding mechanism that's an NIH training grant that actually 2 of our prior vascular surgery residents, Dr. Nate Itoga and Dr. Lizzie George, had both done. So there was some history of collaboration, and then I know there are actually many general surgery residents in our department who have also done that pathway. But I think another important thing to highlight on is through the NIH, that only covers about 50% of your salary that we get paid as residents at Stanford. So there's a little bit of this delta that each division and department handles a little differently. For me, I had some additional funding. So our division of vascular surgery paid for my Harvard statistics course. So that was I kind of had a proposal I gave and said, this is why I think it would be beneficial to our division, and so that got funded that way. And then we had some really generous gifts through the Bazooki Research Fund that also helped support some of my additional research. And then another thing is looking for projects that are already ongoing in your division or department that might need a little bit of research support. So this last year I was helping Dr. Dahlman with his LIMIT trial as the study safety monitor, and that also gave some extra funds to sort of cover my PD time. So it was a little bit of a mix of things and being a little resourceful and working with your division and your department to figure it out. I was thinking a lot about this because I knew you would ask me. And it's not a cop-out, but one of my favorite quotes actually comes from Steve Jobs. He said this during his commencement speech that he gave here at Stanford, now several years ago. But he said, you can't connect the dots looking forward. You can only connect them looking backwards. And so I firmly believe in that. So do I think my PD time impacted my future career? Yes. Do I know how exactly yet? I'm not sure. I mean, I came into residency knowing that I wanted to be an academic vascular surgeon, and I would say my PD time only confirmed that is still the path I want to follow. I think it also highlighted that there are many different ways to do research. So you don't have to be an independently funded researcher, and you don't have to have your own lab if that's not necessarily something you want to do. And I think through collaborating with other specialties, with industry, there's lots of ways to keep your research research productivity kind of high while you're practicing. So I guess the short answer is it definitely has shaped me that I think I know sort of certain areas that I want to focus on, but how exactly it will manifest, I'm not sure yet. So for this one, I took some specific notes that I wanted to make sure I could share with potential viewers. So to your first question of should I do PD time, I think if you have a passion to delve into something, and we've been talking about research, but it could be any other kind of non-clinical professional development activity that you're passionate about. It's such a unique time to really take a step back from your clinical duties and delve into something deeper. And you never know how that might then shape your future trajectory. So I think absolutely it's such a great gift that we have here as Stanford surgery residents to take advantage of. And I think another aspect I didn't touch on is it's also a really nice time for you as an individual, whether that's for me, I had my son, so now he's 2 years old, so that was a great, gift for me and my husband to be able to spend a lot more time together that we wouldn't normally have with our child. Other people, have travel on their agenda or seeing family and friends they haven't seen in a long time. So I think that aspect of feeling a bit more balanced and having a little bit of a breather during your training is a really nice aspect of PD time as well. So I think for junior residents, I really appreciate that the department has spent more time now kind of formalizing the PD pathway. I would say I felt a little more lost as I was going through my kind of like PD planning time. So I think my first advice would be to try to ask some of your senior residents for their proposals or applications and the specific funding mechanisms they applied to, especially if they got funded successfully. So because I think that's a great thing to say, okay, well, what has been done before? How could I model my version of my research proposal after what they've done, and sort of workshop your proposal as early as you can. The other second piece of advice is to talk to other PD residents about their experience and tell them what you're trying to do. And I think you'll get some really good feedback on, yeah, that sounds like a great thing. That sounds realistic. Maybe that's too big of a project. And I think you could also then lean on those colleagues to maybe even write a letter of support for you when you're applying to these things. And that gets into my third point, which is that there is definitely a informal networking that I think goes on with applying for funding. And again, I think it's something that's not really talked about, but it should be, because it's like anything, you need to network for a position. So I think having your PI or your research mentor reach out to some of these different funders and say, hey, this is something we're interested in submitting. Does this align with your goals? That was something that I only learned later in the process, and I think that would have been nice to know, for me to know earlier on. And then my fourth piece of advice is you don't have to put everything you want to do during PD time into your proposal. This was something that I struggled with. I had so many different ideas, so many different things I wanted to do. And Dr. Arya, who was my main kind of clinical mentor on my T32, said, okay, we really need to narrow this down to like one project with 2 to 3 aims that you want to try to do. And if there's other things you want to do, that's fine, but we don't have to necessarily put them into your application. So I think that's other good advice. Have big dreams, but try to pare it back for your specific applications that you're submitting. And lastly, try not to overcommit. This is also time to relax, enjoy your time, travel, spend time with family and friends. So make sure you allot enough time to do that as well.